There are many good foods on the market, yet there are some guidelines I think you should follow to ensure your new cat remains healthy and happy. As I mentioned earlier, if you elect to change your new pet's diet, I recommend you do it gradually over a few-day period to avoid intestinal problems like diarrhea. I recommend any of a number of supermarket commercial brands or pet store and veterinary premium brands. Any of these major brands will meet the needs of your cat. Be sure to look at the label and see that the product has been tested using the Association of American Feed Control Officials, or AAFCO, feed protocol. This testing will ensure the food is nutritionally adequate. You do, however, want to avoid the plain wrap or generic cat and kitten foods. As far as canned versus dry versus semi-moist, the choice is up to you, and more importantly, your cat. Some semi-moist foods contain a preservative, however, which may cause anemia in some cats, so make sure to check with your veterinarian. You've heard that cats are finicky? Well, it's true, and they often dictate what they will and won't eat. I suggest you feed kittens a kitten food for up to a year of age. Then you can switch to an adult food, and remember, you want to switch gradually. I recommend you offer a variety of foods so your cat won't end up with an exclusive preference for only one type of food or flavor. There is one important situation where you may not have free choice to feed just any food. Certain cats develop a condition called FUS, or feline urologic syndrome, now more commonly known as FLUTD, or feline lower urinary tract disease. This disease affects both males and females. However, males seem to be more clinically affected because of their longer and narrower urethra. It is a condition where a cat, for a variety of reasons, such as diet, inadequate water intake, bacteria, viruses, or even stress, tend to formulate crystals in his or her urine, which, when large enough, can cause bladder and urethral irritation and even blockage. This is a very serious problem, often difficult to treat, but can possibly be prevented. Those foods with a form of magnesium which leaves the urine acidic are preferred. It also helps to try and encourage your cat to drink water. If your cat seems to have problems related to FLUTD, such as straining to urinate as evidenced by frequent but uneventful trips to the litter box, urinating in the sink or tub, failure to use the litter box, bloody urine, and excessive licking at his genital region, I recommend you immediately have him examined by a veterinarian. A critical aspect of treatment and prevention will be a modified diet. There are products available that have been tested by a federal regulatory agency and have been shown to promote the health of the lower urinary tract. For specific recommendations, you want to check with your veterinarian. If large crystals are already present, your veterinarian may elect to put your cat on a special diet which is actually formulated to help dissolve existing crystals and stones. In some of these cases, however, surgical removal of the stones may be the only option. Other important aspects of prevention involve increased fluid intake, increased exercise, and keeping your cat lean. What about supplements? Well, if your cat is 100% healthy and is on one of the foods I've just discussed, supplements may not be necessary. If, however, your cat has medical problems, is recovering from a stress like surgery, or is just aging, supplements may be of some benefit. Always check with your veterinarian for guidance regarding supplements. Some skin and coat supplements, if indicated for a specific condition, may also be of some benefit to certain cats. There is one supplement I recommend highly for all cats, particularly long-haired cats, a good feline laxative to help control hairballs. These are loose and shedding hairs which are swallowed by a cat while he grooms himself with his sandpaper-like tongue. If the clumps get too large, they can cause intestinal problems, sometimes severe. There are many brands and even a few different forms available, and all are usually okay. You just want to find out which one your cat likes. Most cats love these and look forward to them as treats. Coat conditioners, agents that control shedding and good grooming, are also recommended to help control hairball problems.